to inform everyone on the call, there's clearly a lot of logos at the bottom of this first slide. I wanted to give make everyone aware that this guide was made possible by the Mental Health Services Act Central Region Workforce Education and Training Partnership, otherwise known as the Central Region WET Partnership. This is a program that's administered by the California Institute of Behavioral Health Solutions, otherwise known as CalMHSA. Additional funding was provided by Placer County. The Central Region WET Partnership utilized some of their funds provided by the California Mental Health Services Act to contract with the California Mental Health Services Authority to create this guide on their behalf. CalMHSA is a joint powers authority representing California's 58 behavioral health agencies and implements statewide prevention and early intervention programs on behalf of counties. Before we get started, just to run through a couple of logistics. All participants are muted, but actually just so that we're being absolutely sure, if folks could mute themselves on their own phone, that way we will reduce the likelihood of feedback, which is always a good thing. As you may have noticed, if you want to ask questions, you are going to have to locate the green tab, likely at the top of your screen or at the top of where the presentation kind of boxes that you're looking at on your screen. You can click over that green tab and you'll see all the options that are available to you. To ask a question, click on the Q&A box, and please be sure that's not the chat box, but it's the Q&A box, and you can type in your question there. When you do so, please make sure to send it to the presenter so that I can monitor your questions. You will be muted for the duration of this webinar, so when you type in your question, I'll be able to read it back to the group at the end of the webinar when we will be fielding a Q&A session. In addition, this webinar is being recorded and will be available on the CalMHSA website in the next few days. So today's agenda for the webinar, I will be briefly discussing the history and background of the guide, and then I'll pass it over to our presenters and really the authors of the guide, Anara Gard and Sandra Black, to discuss the 4 key sections that are outlined in the guide. They'll then wrap up with suggestions for use of the guide and jump into questions towards the end. Just to give you guys a little bit of history on how this guide even came into existence, the first request for this type of postvention guide originally came from the Tahoe Truckee Suicide Prevention Coalition, which serves Placer and Nevada County. Growing from this idea, the Central Region WET Partnership decided to provide funding to create 2 plans. One would be a postvention plan tailored specifically for the needs of the Tahoe Truckee region, and then a guide that can be used within any community. And so today's webinar will really focus on the general use of the guide. In addition, we also have Phoebe Bell, Kim Honeywell, and Allison Schwedner from the Tahoe Truckee Suicide Prevention Coalition today. And they will be speaking up at various points throughout today's presentation to share their experiences in implementing a suicide postvention plan within their community. The Central Region WET Partnership, as I mentioned earlier, contracted with CalMHSA to create this guide, and CalMHSA drew upon its experts in the suicide prevention field, as well as our partners in the implementation of the statewide PEI programs, who are Anara Gard and Sandra Black, who you see here. Just to give you guys a little bit of background on their histories, Anara Gard has worked in suicide prevention for many years and has been providing technical assistance to rural communities in California as part of the Know the Signs suicide prevention campaign and Each Mind Matters mental health movement. Sandra Black became involved in suicide prevention at the California Department of Mental Health, starting with the California Strategic Plan on Suicide Prevention, and for several years at the state's Office of Suicide Prevention. And since then, she has provided technical assistance to counties and community-based organizations under the Know the Signs campaign and the Each Mind Matters mental health movement. I'd like to remind folks, as we now are going to jump into the content, for folks to mute themselves on their phone so we don't have any feedback. And with that, I am going to pass it over to Sandra.
Hello, Teresa. Thank you very much, and welcome, everybody. Making sure I can be heard. Right, Teresa?
Loud and clear.
Great, thank you. You can never be too sure. So postvention refers to activities which reduce suicide risk and promote healing after a suicide death. A system of suicide prevention includes strategies for prevention, intervention, and postvention, yet too often postvention is missing, as many of you are probably aware. Although postvention is implemented after a suicide, it is essential to prepare for postvention before a suicide occurs. So family members of people who die by suicide, parents, children, and siblings, can themselves be at increased risk of suicide, and a death can affect those beyond the immediate loss survivors and ripple outward into an entire community. Although they are rare events, suicide clusters and suicide contagion also provide examples of how exposure to suicide can increase risk. Media reports on suicide can contribute to contagion as well, or on the other side of it, they can also help to reduce risk. So postvention is prevention. Suicide prevention efforts should include a comprehensive postvention component that reduces risk and promotes healing for the immediate family, but that also reaches out to the community to support the broader group of loss survivors that can include friends, coworkers, first responders, and treatment providers, as well as others. Next slide. On the slide here, you see the goals of postvention, and these really do provide the framework for this guide, as well as the plan that this guide was developed to support. So just to review them briefly, postvention includes, postvention supports healing of anyone affected by the suicide, the lost survivors, but also the community at large. It offers support to at-risk individuals and can reduce the likelihood of additional attempts or deaths. It helps individuals and organizations respond promptly and appropriately. And finally, it offers messaging and activities to help educate the community about suicide prevention. Next. So why a rural postvention guide? So rural areas tend to have higher rates of suicide than more urban areas. We see this within counties in California as well as across states around the country. Suicide risk is compounded by several factors that are inherent in rural life, such as limited resources and services to meet wellness needs, the need to travel distances often to access care, greater levels of poverty, an older population. Some other factors include often a higher concentration of firearm ownership, and the rugged individualism and independence that serves people well in good times can actually inhibit health seeking when they're struggling. Natural disasters such as fires and drought often strike rural areas with greater intensity, taking a toll on community resources and resiliency. And finally, Anara and I spent quite a bit of time looking around for a resource like this one here, and we did find some really good postvention resources, but they tended to be for closed communities like schools or the military, and we weren't able to find something that addressed the community, the whole community, and certainly not rural areas. So the Rural Postvention Guide came about.
Get out of
it. Next slide. So the purpose of this guide is to assist in developing a coordinated and customized local plan to guide postvention response. It was created with rural communities in mind, but it can also be useful in other communities. It provides a framework for monitoring a situation as it unfolds to reduce contagion risk and increase support to those who need it. What it is not is a set of guidelines or a recipe that must be followed. It incorporates the understanding that all communities are really fairly unique and their plan should be developed within. It presents a robust framework to support a customized and local plan that accounts for the unique characteristics of individual communities. Next. So what does a postvention plan include? It includes multiple points of support for lost survivors, witnesses, and anyone in the community impacted by the death, activities to reduce trauma among those impacted, accurate information, including timely notification of the death to those who can best mobilize support, appropriate responses that include flexibility to address unique circumstances as they unfold, incorporation of prevention messaging and education, and a process to review the response to learn what went well and what can be done to improve the plan. Next slide. Lost survivors are those anyone who has lost a friend, a family member, or a loved one to suicide. So as many of you are aware, grief after suicide loss is complex and often includes guilt and shame among those left behind. It's traumatic for those closest to the deceased, and it can also have a devastating ripple effect on whole communities, especially in rural areas where social networks are tighter and everyone knows everyone. Support to those affected by a death needs to account for successive waves of impact, both on who is affected, the more distant they get from the individual that died, and over time. In the immediate aftermath of loss, survivors are coping with shock and denial and the guilt, the shame, alongside the need to adjust to the details of life without their loved one, such as holding funerals or memorial services, and in many cases also coping with the financial results of the loss of the individual. So as a result, the lost survivors might not be in a position to accept support for weeks or even months after the death. So the plan should include strategies to offer information about support several times. And now I'm going to turn it over to Anara to talk a little bit about some of the activities that provide the building blocks for the plan.
Thanks, Sandra. Some of you may have already downloaded copies of the guide from the CalMHSA website, and if you haven't, that link will be up at the end of the presentation. But we wanted to make sure to orient you all to the guide. So section 1 focuses on activities to do. Section 1 is on the activities that, I'm going to switch from the headset. One moment, please. Section 1 is activities that can be done before a suicide occurs. Next slide, please. I'm seeing some messages of people not able to hear me, and I'm hoping that this is improved. Can anyone verify that?
I can hear you pretty well, Anara. Maybe can a participant type in something just to let us know that some of you are hearing her?
I swapped from a headset. Okay, great. I see some messages. Thank you. Great. I won't put, thank you. Okay, beautiful. All right. So one of the first things that we encourage you to do is not to wait until a crisis occurs. Having this foundation in place will really help you have this more seamless flow of events and ultimately a more efficient and effective response. Just like we often plan for disaster response, we don't wait until the flood occurs. That's exactly the kind of approach that we want to take here as well. So in this postvention planning process, most of the work happens well before your community experiences a suicide death. But it's not as daunting as it may seem, even though we're going to show you a number of steps. Your community might already have some of these components in place. And there's going to be some overlap among the key stakeholders and your suicide prevention coalition, if you have one, and your core team, which we'll be explaining in a moment. So you need to first identify the community that is going to be served by your plan. It could be as large as a whole county. It could be a portion of a county. It could be some other subset, or maybe it's a multi-county region. In every case, you want to be very clear about the purpose of the plan, going back to those goals of postvention, and start engaging these key stakeholders. You'll need to talk about what kind of information will and won't be shared so that confidentiality is maintained as needed, and information sharing can happen as readily as possible with people who do need to know in order to be able to provide those loss survivors who are most immediately affected with the support that they need. So forming these relationships, whether they're just trusting open relationships or formal agreements, is really key. Next slide. First responders, which is an umbrella term for coroner and law enforcement, as well as others who might be called to the scene when a death occurs, for example, law enforcement chaplains, they are the primary source of timely information about a death. It's ideal if your coroner and law enforcement are really engaged and fully participating in this process. And you can engage them, if they're not already, by really emphasizing how having this postvention plan is going to augment their work, not interfere with it. You're going to be providing needed services or a warm handoff or resources to help support those individuals who've been bereaved. It's ideal if you can advocate to learn about suicide deaths in a really timely fashion, ideally within 24 hours. We recognize that's not always possible, but that's a nice goal to aim for. And you can also try to determine if you need to have a formal agreement with your first responders or not. But in any case, you really want to have them engaged, and it's vital that they're involved as much as possible. But if you can't get immediate notification, find out what you can get and start from there. We can always work on improving that timely notification. Next slide, please. This is an example from the guide that is not an exhaustive list. It's also not a minimal list, but just some examples of key stakeholders that you might want to have involved depending on your own local situation. However, loss survivors, down the list about a third of the way, are vitally important to be involved. You really need to hear their experiences and to respect what they have to offer to your process. Next slide. If your community has a suicide prevention coalition, great. Those are folks who you can engage right away. Many suicide prevention coalitions are very focused on prevention, and taking on a postvention role will be new to them, but definitely fits in within their scope. They will really be helpful in the prevention planning aspects, which we will get into a little bit later on. Sometimes your suicide prevention coalition might have gone a little bit dormant or a little bit stale, and getting them involved in creating a postvention response plan might really help revive them. And if you don't have one, this effort might be a good impetus to start building a suicide prevention coalition. But if you do have one, these are the kinds of roles that they can play by working on partnerships, providing oversight and guidance to the whole process, and making sure that the lessons learned from providing postvention support get translated into prevention strategies. Next slide, please. So we're still talking about the steps that are done before a suicide occurs as part of the preparation process. So you've defined your community, you've engaged your stakeholders, involved your coalition, and now with those key stakeholders, you want to gather information, which might include data on the deaths that occur, on non-fatal self-injuries, on call volume to your crisis line and warm line. It might be information on what plans and protocols already exist, including crisis plans that are ongoing in your schools, since many schools do have plans should a suicide or other untimely death occur. So what does suicide look like in your community, and what does the response look like? What happens after someone dies by suicide? How does information about the death flow? Who hears about it first? In some places, the behavioral health agency learns about it only weeks later or only through the local news. Sometimes local media doesn't cover it at all by policy unless a death occurs in a public place. Some counties are using law enforcement chaplains to provide support. So you need to know your local culture and your local practices and figure out what formal response plans are already in place so that you're not duplicating efforts or reinventing the wheel, but instead figuring out how you can fill in the gaps. All right, let's hand it back to Sandra.
Thank you, Inara. So now we'll talk about the core team, and this is a really important component of the plan, of the guide as well. So the core team are central drivers of the plan. They oversee implementation of the plan, they help mobilize services and support, and they monitor the circumstances throughout the community after the death to determine what the appropriate next steps will be. Core team members should be 1 to 3 individuals, very carefully chosen, trusted individuals with whom first responders would be fairly comfortable sharing sensitive information or can become comfortable sharing sensitive information. Usually it would include someone from the behavioral health agency most likely, as well as at least one individual who is very skilled in counseling suicide grief. Core team members should be able and willing to have their contact information shared directly with lost survivors to facilitate a personal touch and to ensure that the survivors will know that help and support are available and that this individual can really help you get where you need to go. Throughout the aftermath of the suicide and even in between, the core team can be a go-to source of information about the services and supports for lost survivors and to promote healing, as well as to offer education and messaging around suicide prevention to the media and to the public, in addition to their role working with those who are directly impacted by the death. Next slide. So the specific tasks of the core team and the plan are to receive information about a suicide death, as Inara described, ideally within 24 hours of the death and directly from first responders. They're not, however, expected to be on standby or available 24 hours a day necessarily. And even if the core team learns of a death and informally or after the fact, meaning more removed in time than this sort of immediate notification concept, they can still launch the plan from whatever point they do learn of the death, beginning with mobilizing support to the family and friends affected. Connecting lost survivors with services and supports is most effective when it's proactive, actually reaching out to those affected, and when it occurs in multiple points of time, both in the immediate aftermath and also later when lost survivors may be more able to take advantage of it. And the core team coordinates the response steps, and again, as we mentioned before, they're the go-to source of information for those affected in the public as well as the media potentially. Monitoring contagion risk and helping determine level of response. And many of these tasks are done in coordination with the Suicide Prevention Coalition and also other key partners. Next. So to effectively offer support, you need to know what's available and be able to have this information at the fingertips of those who will mobilize the support. So one of the important steps is to create an inventory of services and supports that can really be helpful to lost survivors specifically. So it should include as broad a range of options as possible. Obviously, this list would look different in different communities, but some of the ranges of options that would be useful would be things that are offered both online, over the phone, or in person, so different types of venues, things that are local as well as things that are out of area. In some cases, people may be more comfortable accessing services that are not within their community. Any behavioral health agency services that might be available that offer counseling to people at low or no cost potentially. Any mental health providers who have training and experience in counseling suicide grief. Clergy and chaplains Any peer support services, and here specifically would refer mostly to peers as other loss survivors who may have organized a group or a support program for peers. And as I mentioned a little bit earlier, having a range of services that are low or no cost and that also might be covered under private insurance just helps people just cover the widest range of options possible. And one note of caution, those compiling the inventory may want to look at the generalized grief support groups that are available in many communities, but this should be done very carefully. The complicated grief following suicide is different from the grief that people experience who've lost a loved one to other causes, and suicide loss survivors may not feel comfortable or even supported there. So those should only be included with caution, with some research. Next slide. So to facilitate mobilizing support, it's essential to develop some kind of materials that can promote those services and supports, such as a card or a brochure. And the card or brochure, again, it depends on the size. If it's a card, it would at minimum have contact information for a quarantine member that can offer a warm and a sympathetic ear, but also help to navigate the options. And a brochure could also be expansive enough that it can include language to help encourage loss survivors to recognize that they aren't alone, that someone out there really understands, and that there is help available, and lay out different services and supports. The tools section of the guide includes a template for a brochure, and after developing the card or the brochure, be sure to have enough copies of it printed that you can hand it out to key people who would be interfacing with those who just experienced a loss, such as first responders, so that they'll have that supply to share. And finally, a community suicide prevention website would be useful for many reasons. Certainly, it can be used to promote loss survivor support options and to offer educational information about suicide prevention, like warning signs and how to help. And the suicide prevention website can be a page within an existing site or a new page created just for this purpose. Next slide. So there are few situations more stressful than feeling put on the spot in a crisis without some kind of guidepost to help navigate communicating with the media and the public. And depending on the community and the circumstances, a suicide death may result in pretty sudden and intense attention and questions. And having a plan for communication in place ahead of time makes the job easier for those who interface with the media and the public. And it supports effective and constructive messaging about suicide, and that can be deployed in a rapid and timely manner when these types of messages really most need to be heard. And the communication that occurs in these situations isn't intended to share detailed information about an individual death, but to make sure the public knows about the resources that are available and to offer comfort and healing to the community. Some of the venues for public communication could be monitoring and potentially responding to media coverage. That could be news media or social media. It could be issuing a public statement to either targeted sectors of the community or the community at large. And there are tools and resources in the guide itself for how to build these sorts of public statements. Next slide. I'm turning it back over to Anara now to talk specifically about the postvention response itself.
Thanks, Sandra. So the first third of the guide focused on developing your postvention plan, and section 2 focuses on how your community can respond and build this response plan. Next slide, please. This graphic shows in very simple form the community response process. So at the top, the core team is notified when a death occurs. They offer support, or they mobilize other people to offer support to those who have been affected by the death. They gather more information as you go along, and as you learn more information, you mobilize others as needed. And then there's another round of offering support. This differs from many postvention plans that only mention offering support once, but we found that many times, as Sandra mentioned before, people who are newly bereaved are not yet in a position to be able to respond, and they really appreciate having another opportunity, and sometimes multiple opportunities, to receive helpful support and to take advantage of resources. They may have lost the brochure, and they need to be reminded. And then finally, this reviewing and learning step. It's a process from which you continue to learn and build, so that then the next time that your core team responds, you can do an even better job. Next slide, please. So in every death that occurs, these are the steps that we recommend. You want to actually establish, confirm the facts and the circumstances, and document them to some degree. Then mobilizing and offering support, communicating carefully, as in the slide that Sandra was just showing about communication. And then you need to determine whether or not a broader response is needed. We'll talk more about that in a few slides, but a broader response affecting the larger community might be needed because in rural communities, people are very interconnected. The school bus driver also drives the snowplow, and the hardware store manager coaches the soccer team, and you bump into your doctor or your therapist in line at the grocery store. People are very affected when they lose a member of the community, and sometimes having a broader response is really called for. Next slide, please. So the question about timely notification, as we mentioned in the beginning, it's not always possible. But even if you can't get that early notification in the first 24 hours from the first responders, even if that's not feasible, you can still have an effective postvention plan. In some cases, we've heard that behavioral health, for example, doesn't hear about a death for several weeks later. It's not too late to offer support. The bereaved still are in need of support. It's not all fixed and gone away. So the first 24 hours is not vital. And these steps in the guide can be implemented from whatever point your team learns about a death. We do still get some background noise, so if you haven't muted yourself, it's a really nice thing to do. So start where you are. Over time, earlier notification may become more possible as the core team becomes recognized as a resource in the community. Your first responders might be more open to having a notification protocol with you. And as we said before, you can really build towards what feels like a more ideal process as you learn and grow. Next slide, and we'll hand it back to Sandra to talk about that community-wide response.
Thank you, Nara. So one of the questions that sort of launched this work was really trying to understand, when is a community-wide response needed? In most cases, additional steps beyond those that Nara just covered, which are taken for all deaths, won't necessarily be needed. But as Nara did say, especially in smaller communities, the overlapping social networks and the ripple effect can really extend pretty broadly into the community. So the guide offers some additional considerations that will help the core team monitor when a broader targeted or community-wide response might be needed. So they aren't comprehensive, but these factors on the slide give you some guideposts that when these occur, you might want to look closely at whether you want to start planning a broader response early. And those would include things like a suicide in a public place or a suicide of a well-known figure in the community. If the death has been the subject of extensive news or social media coverage, homicide, suicide, and when more than one suicide occurs in an unusually short time frame, indicating that there might be potentially some contagion risk. Next slide. So after being notified of the death and the circumstances, the core team will consider these factors in assessing the risk of contagion, and will continue to monitor how the situation unfolds in the community to decide what response level might be needed. In some cases, a targeted response within a particular sub-community might be helpful. For example, if a student or a teacher or a parent dies, working closely with the school community. Or another example might be if a client in the behavioral health system dies, working closely with behavioral health providers and other clients to mobilize targeted support. Next slide. So some of the options for a community-wide response could include having a public meeting or a forum. The tools section of the guide includes additional considerations for public meetings to sort of help with the logistics of planning those meetings in the content, as well as a sample agenda of a public meeting. Strategic suicide prevention training, and we'll be talking more about that on the next slide. Issuing a public statement or even a public health alert in certain circumstances can be helpful, and the tools section of the guide includes samples of both of those. Monitoring and responding to the news and social media. So the resources section of the guide also provides some helpful links for these. And disseminating materials like brochures or know the signs materials or other things that can help promote prevention education or loss survivor information. Next, please. So stepping back to suicide prevention training for just a moment, it's not uncommon to jump to suicide prevention training as a way to respond after a death. And as you probably know, suicide prevention training focuses on warning signs and how to help, which is very useful information. But the immediate aftermath of a death might not be the best time to offer this type of training. The first and foremost concern is to promote healing and to get support to survivors. And for some loss survivors, may initially hear prevention messaging as feeling blamed for not having done enough to help their loved one. And in general, suicide prevention training is going to be most effective as part of a larger strategic planning process. And potentially, in some cases, a targeted response can help, that includes suicide prevention training, can help address contagion risk. One example might be if an older adult in an assisted living facility dies by suicide, maybe staff there can receive some training relatively promptly to recognize and respond to risk, which might benefit other residents who could be, you know, having some distress as a result of the event. It doesn't necessarily have to happen in the immediate aftermath, but suicide prevention training is definitely helpful in general to strengthen the system of suicide prevention in the longer term, which leads us directly to the next slide. Planning for prevention is an integral part of postvention. It translates what's learned from postvention activities and organizes a process to review the data and information about deaths that have occurred and brings them into strategic, targeted, and effective prevention strategies. One role of the core team, as we mentioned earlier, is to compile information about the postvention responses that have occurred and reporting this to a planning body, such as the Suicide Prevention Coalition, which can take on the task of assessing how the plan has been implemented and modify it as needed to provide a better response in the future. Certainly, prevention planning should also engage the key stakeholders who we talked about earlier to contribute information and ideas, as well as to support implementation of the strategies within the systems that they influence. So at the end, the prevention planning bodies, such as maybe the Suicide Prevention Coalition, can review the postvention information and also examine suicide data on a regular basis, say annually, and work to identify trends and potentially gaps that can be filled. And data can certainly include death data or injury data and call volume to crisis centers. And information about where to find this type of data is also included in the guide. Next slide, please. So over the past few months, Anara and I have worked closely with the Tahoe Truckee region to develop a postvention plan for their community, and this was richly informed the contents of the guide. During this time, we met with the Tahoe Truckee Suicide Prevention Coalition and key stakeholders there, and we also conducted a community survey to gather input for their plan. Some of the lessons learned from this process are summarized here, and we're sharing them as helpful exclamation points to certain sections of the guide. First and foremost, relationships are crucial, and sensitivity of details about suicide deaths and concern for the privacy of families, the need for timely information sharing, all of this make it essential to have really strong and trusted relationships, especially between the core team and first responders. And the devil is surely in the details. Part of building these relationships and trust is honest, open communication about what information can be shared with whom and how it will be used. And you must know what's available to offer it. For example, creating the brochure and the inventory of resources will ensure accurate and up-to-date information is readily available to get this support quickly to those affected. And support to loss survivors will most successfully reach its mark when it's offered proactively and on more than one occasion. Passively listing or simply having the services and supports doesn't help lead those who need it to find it and to overcome whatever difficulties they may have to reaching it. Finally, families come first. After a death, the needs and wishes of families should be determined early and followed as much as possible. First responders and other key partners are going to be much more willing to engage in postvention when they know that the families will quickly benefit from the support that's offered. And last but not least, loss survivors are key stakeholders themselves in the postvention process and certainly in planning. So at this time, we have 3 of our key partners from Tahoe Truckee on the line here, and I'd like to briefly introduce them and then turn the line over to them to talk a little bit more specifically about some of the aspects of their plan. I'll just introduce the 3 of them, and then while I'm doing that, if you guys could unmute yourselves, and shortly we'll be turning it over to you. So Phoebe Bell is a program manager for Health and Human Services in Placer in Nevada County. She previously ran a suicide prevention crisis line for Northern Nevada, and she also lost her father to suicide, so she brings that perspective of a lost survivor as well. Kim Honeywell is the Suicide Prevention and Intervention Coordinator for Nevada County. She serves on 2 suicide prevention coalitions and is an assist and safe talk trainer for Living Works. And Allison Schwedner is the Director of the Community Collective of Tahoe Truckee. So I believe the 3 of you should be unmuted, and we'll look forward to hearing what you have to say.
Sure, this is Phoebe. I'm going to jump in first, and just briefly, I don't think I can say strongly enough how critical we've found relationships to be. Living in a small community, people really want to work with people they know and trust, and so proactively building those relationships has been, I think, really critical for us to feel successful in doing this work. Thankfully for us, we have a long history of close collaboration in our area. The Community Collaborative that Allison represents is a consortium of most of our nonprofits and public entities, and we've sat around tables together for nearly 20 years, and so I've had a chance to really build those relationships. But even with that, building the connection with law enforcement was particularly challenging. A piece of that is a logistical issue. We are pieces of 2+ counties, a town. We have a big CHP presence in our town because I-80 runs through us. And so between all those entities, it's a lot of different bureaucracies to interact with. And I think the thing we found to be most critical in trying to build some buy-in from each of those entities to this idea of having a core team, and really the key piece being that they're willing to share information with us when there is a death, has been really stressing to them our end goals, which are about supporting families and about preventing future suicides. They're coming from the perspective, absolutely correctly, of really wanting to protect people's privacy, and we absolutely agree with that, and yet also see services that could be brought to bear that might actually help people. And so working together to understand each other's needs and that we can benefit each other has been really important. And I think we're finding really that it's a relationship made stronger over time. So as we kind of worked even just to identify who would they be willing to share information with, who's going to be essentially on our core team, something we found right off the bat is that for our law enforcement partners, having that core team consist of people who were employed by the counties was really important to them because they felt like as fellow public employees, we were bound by similar laws and also sort of ethical obligations of serving the public good. And not that nonprofit partners and others don't have those same values. Of course they do, but somehow it made it an easier connection for law enforcement to work in that way with county staff versus nonprofit staff or others. And, you know, once we've identified those partners and kind of worked to build those connections, how we're using the core team is that ideally our law enforcement partners call us when they hear about a loss, and myself or Kim Honeywell will talk with them and kind of together decide, okay, you know, we'll reach out and provide some support and resources to this family or this person or that, you know, small group of people that have been immediately impacted. And we think that's enough for right now, but let's check back in 24 hours and see if anybody's heard anything more, if it's rippling out more, and slowly deciding together whether we need to escalate a response or not. And I think that's been the other key piece of starting to be successful in this process is working together to decide when we need to do more or when we don't need to do more. That conversation is what's building the trust between us. So with that, I'm going to turn it over to Allison to talk briefly about some of our other things we've learned along the way.
Thanks, Phoebe. And can you hear me okay?
Yes.
Great. So I just wanted to talk a little bit about our coalition and the role of our coalition in our response protocol. And just a quick little piece of background. Like Phoebe said, our community collaborative has been around in some shape or form for almost 20 years. However, our suicide prevention coalition is relatively new. We started convening about 3 years ago and really initially came together in response to a number of local suicides that we experienced in the Tahoe Truckee area. And our coalition is comprised of leadership staff from our hospital, our school district, our county, and some of our key local nonprofits. So it's actually a relatively small coalition. And the way the protocol works is that when the core team, so basically Phoebe and Kim, when they recognize that there may be a broader community response that's needed, they'll go ahead and kind of mobilize a coalition and pull the coalition together. Our coalition meets on a monthly basis, on a regular basis, and if we need to, we can get together relatively quickly if there's a situation where we need to respond to as a community. And so because the coalition really has a broader reach than the core team, we really serve as kind of the eyes and ears of the community and really kind of have like boots on the ground and can hear if there's, you know, increasing community concern or what's happening within our different agencies. And so at that point, we can determine what kind of response we need to really mobilize as a broader coalition. So whether it's providing support to coworkers in our workplace or working with our local media outlets around articles in the newspaper, or convening community meetings. A lot of that work is done at the coalition level, and because the right people are at the table, we can get those things done relatively quickly. And again, I would just emphasize what Phoebe said, that these are folks who have been working together for a while, and specifically in the coalition setting for the last few years. So with that, I want to turn it over to Kim Honeywell to talk a little bit about kind of the rural aspect of our work.
Hi, thank you, Allison. So I guess when I think about this guide and what it means in terms of possibly helping to meet some of the needs of the rural communities, I would say that, you know, we're probably no different than many rural communities where you might say we have like 3 degrees of separation. There's a certain connectedness that we have and threads that run through. So when a sudden and traumatic death like suicide occurs, you know, we're all heart-stricken over that. And I feel like also, you know, in a small community, well, sound travels faster than the speed of light. And so having this guide available to maybe help guide us a little bit, no pun intended, to be able to have a sort of lessen the severity and the negative impacts that could be associated with suicide death, I think is something that this guide can offer. It will help, I think, reach the lost survivors, which includes family and friends, and coalition members themselves, because we're very impacted in feeling the weight, and sometimes are the sort of the container holding it all together, and that can be pretty daunting. And then the community at large might be hurting as well, and so being able to offer some postvention is a really important and critical piece that this plan is essentially all about. So I feel like rural communities could benefit by having this sort of balance between the head and heart come together to help lift each other up.
Thank you very much, you guys, for those fantastic insights. And we're just going to move into the last part of this before opening it up to questions. So, Anara, are you ready for the next section?
Great. Yeah, we'll quickly go through this. There are a number of tools in the third section of the guide. Several of these we created and others we drew from the field. Next slide. The master checklist is really an essential part. This slide only shows you the beginning of it. If you download the Word version of the guide, you can copy out the master checklist as its own standalone Word document, and then you can modify it and use it to keep track of what you learn in a suicide death, what kind of resources are being offered, and what kind of responses you get. Next slide. We also included a sample confidentiality agreement based on some real ones that we have seen. This can be helpful as your core team is making relationships with first responders and others. Next slide, please. We put in a sample loss survivors brochure modeled after one that came from Fox Valley, Wisconsin, the Center for Suicide Awareness. This shows one side of the brochure. The other side is also included. And again, you can download this, add your own logo and URL, your local phone numbers, print it out, and have it available. Next slide. There are other tools. There is a real-life example of a coroner offering a condolence letter to families that have experienced a suicide death. There are considerations for how to hold those community meetings that Sandra described, and an example of an agenda from one such meeting. A sample public statement that could be issued, and an example of a public health alert that was issued by a number of counties that combined together and had their public health officers issue an alert which was sent to health providers throughout the counties in responding after some suicide deaths. So there's a number of tools, and we really encourage you to use them. Sandra will describe the final section of the guide.
So the final section is resources. It's a rich list of resources to help inform different parts of the plan, help you delve a little bit deeper into different topical areas. And we categorize them into different subsections, and there's far too many to spend time listing those out here. But some of the chunks of resources that are included are things around postvention planning and training, survivor support and creating programs for lost survivors, planning memorials and funerals, and things to support broad community response and targeted community response options, resources for media and social media response, and resources to support suicide prevention planning. So at this time, I'm going to turn it over to Teresa to conclude.
Thanks, Sandra and Anara and Kim and Phoebe and Allison for all of that input. This wraps up the content review of the guide. And as we mentioned earlier on, if you want to access the free PDF and Word document version of the guide, you can go ahead and visit the CIBHS website. The link is here. You will be directed to this web page after the webinar ends, so that should, I believe, be popping up for you. If you have any further questions about the guide, have any questions about how to use it, if you require any additional technical assistance, anything like that, go ahead and contact Gina Ellert. She is the Central Wet Region Coordinator, and again, this is a product that was funded by the Central West region, so this is really their product. Gina's information can be found here, so go ahead and call her if you have any questions. And so now we have about 5 minutes left to answer any questions that you might have. So the Q&A box is open. Please go ahead and type in any questions you may have for all of our presenters today. If you do ask a question, please go ahead and send it to the presenter so that we can take a look at them. The only question that I believe we have received so far is for the Tahoe Truckee Suicide Prevention Coalition. Megan asks if you could repeat who the members of your core team are.
Sure. For us, we have 2 county staff. So one is Kim Honeywell, who's the Suicide Prevention Coordinator for Nevada County, and then myself, I'm a program manager for Health and Human Services shared between Placer and Nevada counties and managing the services specific to the Tahoe Truckee area. Our community's got a lot of county lines running through it, and we're 60-plus miles away from the county seats of both Placer and Nevada County and also El Dorado County. So we're a little bit physically or geographically isolated up here, so that poses its own sort of set of challenges.
Thanks, Phoebe.
But as we were recommending in the guide, the members of your core team can really vary. They very likely will be somebody from public health or behavioral health, but the other member or 2 of the core team will really vary depending on your own circumstance.
Thank you, Anara. I invite folks to add in any other questions they might have in the remaining minutes that we have. We will just take a look and see if any additional questions come up.
And while people are doing that, just to add one thought, this is Phoebe again. I know in our community when we've been facing these situations where we feel like a lot is happening around suicide, whether it's a number of suicides in what feels like a small period of time or the loss of really visible people that are really impacting a lot of people in our community, we've really struggled with what to do, where to turn, and we're excited to have this written guide and to be able to use that as sort of our guidebook to how we're going to handle situations in the future. But I also want to say, feel free to reach out to any of us if you guys are faced with situations in your community and you're not sure what to do or you want insight as to how certain things we've tried before worked for us. We're happy to share the experiences we've had so far.
That's great, Phoebe.
Thanks, Phoebe.
And I'll just also say, if you don't have questions, feel free to type in your comments on the guide or how you envision using it in your own location. We'd be very interested in learning that as well.
And we have another question from Megan. I believe this is also to the Tahoe Truckee Coalition. What types of prevention trainings are you using in the Tahoe Truckee area?
I'll start, and Kim, you jump in.
Yeah, sounds good.
The main strategy we've actually ended up using is taking the Know the Signs information from the state and developing sort of a mini training around that. And we set ourselves a goal of reaching 5,000 people in our community with that information under sort of the premise of sort of that it's the average people in the world, it's our social networks, our friends, our family, our coaches, our book group members that are the most likely to know when somebody's suffering. And if they can have just even a little bit of information about recognizing the signs and reaching out for help, we might be able to pull more people into support. And so we've really focused a lot on spreading the message of the Know the Signs campaign. Additionally, we've trained a number of people in QPR, and then we also have a number of people trained in Assist. So we sort of see it as a tiered layers of prevention knowledge that we're using in our community. Kim, you want to add anything to that?
Well, that fairly well covers it, but I will say early on we did have the Know the Signs folks come in, Teresa and Sandra, and do a media campaign to help about educate our community and stakeholders and media on responsible reporting. And so that was a great jumping off point where we could engage with our media stakeholders, and they've been super to work with, really receptive, and so that's been a nice bonus there. And then we do have other best practice programs as well, Safe Talk, Assist, as mentioned, mental health first aid, and QPR. So those are sort of rounding out the big push, which is, of course, as Phoebe mentioned, know the signs.
Wonderful. Since it's 3 o'clock, I think we can go ahead and wrap up here. Thank you, everyone, for participating in our webinar today. Thank you to all of our panelists. Please, again, take the time after this webinar closes out to download the guide, and you can contact Gina, again, if you have any questions for follow-up. The recording for today's webinar will be posted at in a couple of days' time. So I think thanks again, everyone, and have a great rest of your afternoon.